welcome back to my channel. So in this video I'm gonna give you guys an easy way to remember contraceptives and answer their questions. So I got this question from Lectorio. I'm gonna read the last two lines first. A urine pregnancy test is negative, meaning she's not pregnant at the moment. She wants a more effective long-term contraceptive method. Which of the following is the best option for this patient? So before reading the vignette, guys, I'm gonna exclude in the answer choices any contraceptive that is not long-term, right? So for example, mifepristone, it's not even a contraceptive, it's an abortifacient that is anti-progesterone. Ulipristal acetate is an emergency contraceptive that's a progesterone blocker, as we're gonna explain, and it's not long-term, right? Ethana estradiol, nobody, guys, takes estrogen alone because it can increase the risk of endometrial hyperplasia and cancer regardless, so no one will take estradiol on its own like this just for contraception. So we are between copper IUD or levonorgestrel. Now, which one is more long-term? Copper IUD, guys, stays for up to 5 years, sometimes even 10 years, right? While levonorgestrel requires, if it's part of a progesterone-only contraceptive, that she takes it every day orally, or probably if it's a Depo-Provera, will take it every 3 months. So the only possible answer choice here is C. So you can see here, guys, that I answered the question just by exclusion without reading the whole vignette. But let's read the vignette and see. An 18-year-old woman presents to the medical clinic 4 days after a condom break-in during sexual intercourse. The patient does not wish to get pregnant and requests emergency contraception. So another thing I should keep in mind here, guys, in addition to choosing a long-term contraceptive, is that I should choose one that works in the emergency setting for emergency contraception, as we're gonna explain, right? She's currently monogamous relationship, has never had an STI, is important to mention because this is a contraindication to using IUDs. So right now it's fine, we can use IUDs for her. So before we move on, guys, to explaining the easy scheme for contraception, I would like to show you a very nice offer by Lectorio. You can get 50% off the 1-year plan only until January 4th, and also you can get 20% off any other plan using my discount code. So take a look. So an easy way to understand contraception, guys, is to take a look at the requirements of making a baby. We need a functional sperm, an oocyte, and a good uterus that is prepared to receiving a baby. If we stop anything along this pathway, we are preventing conception, which is contraception. So we can either block the sperm from reaching the ovum through barrier methods like condoms or spermicides, and these are short-term and have high failure rates. Or we can essentially stop an oocyte from being produced in the first place by preventing ovulation, and that is through contraception, hormonal contraception with estrogen and progesterone. Alternatively, we can also stop implantation of the baby in the endometrium, and that's by making it unfavorable through IUDs, right? Speaking of which, the mechanism of IUDs, guys, is that it's toxic to sperm. And so even if sperm do ascend through the uterus, it creates an inflammatory reaction that is toxic to the sperm, and the macrophages can eat up the sperm. Plus, this sterile inflammatory reaction, the endometrium, is unfavorable for the zygote, even if it does form. Now, for question purposes, guys, it's important to know that IUDs are long-term. They can stay for years, as we saw in the question, and they're very effective with only 0.5% risk, or 0.5 women per 100 women per year failure rate. which is very minute. All right. Now, there are, of course, side effects to IUDs that we should take into account, and they could also be contraindications. The most important being bleeding. And if it's very disturbing, we can replace the copper IUD with a Mirena or progesterone containing IUD, which of course reduces bleeding. That's one high yield fact. Another, guys, is because most IUDs are made of copper, we cannot use them in patients with Wilson disease who cannot excrete copper. Also, because the IUD has to fit inside the uterus, any uterine deformity that pushes out the IUD or makes it of high risk of perforation or expulsion is a contraindication to usage. Finally, guys, if this person has a history of an STI or PID, this is a contraindication to using IUDs because the threads act as a kind of path to ascent of the bacteria and causing PID. All right, these are high yield facts, guys, that are commonly asked. Next up will be hormonal contraception if we want to stop an ovum from being produced in the first place. If we give estrogen and progesterone, the synthetic ones, guys, in contraceptive pills or injections, these exert negative feedback on the pituitary, stopping gonadotropin release, which means that the ovulation will not occur because follicles will not develop when they do not have FSH and will not rupture because they don't have LH. Right? Progesterone, guys, has an additional mechanism of action, which is creating a thick cervical mucus plug so that sperm do not ascend and reach the ovum in the first place. Now, for these hormonal methods, we either have oral contraceptive pills and vaginal ring, and these require that the patient be alert and take the drugs as indicated and be highly compliant. For this reason, women who forget to take pills can be offered the long-term option every 3 months, contraceptive injection, or they can also have the patch, transdermal patch. All these are possible options, or the implant of progesterone that stays for 3 years. Now, obviously, guys, because these are hormonal, they have various side effects and therefore are contraindicated in certain diseases. For example, estrogen increases clotting factors and there is a very high risk of DVT. Therefore, it's contraindicated in someone who had a previous DVT or embolism. Now, they're also contraindicated if someone had coronary artery disease or had a previous stroke or hyperlipidemia and hypertension, which are themselves risk factors, right, for atherosclerosis. Also, if we have a smoker over 35, this is an absolute contraindication, or someone with liver disease because estrogen increases liver enzymes. And also, if someone has an estrogen-dependent tumor like breast cancer, that's a contraindication. All these, guys, are possible question points. Finally, I want to talk to you guys about emergency contraception if it's unplanned. The most effective method for emergency contraception, guys, with a 99% success rate would be the copper IUD or the IUD in general, but mainly the copper IUD. And this is also long-term, can be taken within 5 days of unplanned intercourse. Now, another effective option, which is 98% effective, and that's oral, is ulipristal. This, guys, is a progesterone receptor blocker. So here, instead of progesterone binding to its receptor, ELA1 or ulipristal will bind instead. And because of this, it's going to prevent follicular rupture, preventing ovulation. Or if ovulation already occurred, then it will prevent the action of progesterone on the endometrium, making it unfavorable for implantation. The last possible option, guys, for emergency contraception is Plan B or levonorgestrel, and this has to be taken within 3 days. But obviously, because this is hormonal, this is a steroid, there is and has to be taken very high doses to achieve an effect. There is the side effects of dizziness, nausea, vomiting, breast tenderness, etc. All right, guys, I hope this helped.